Hi everyone. I was prompted to choose a research topic for my Intro to Research in Biology class, and I chose a topic related to head and neck cancer, personally just because it's affected my family. But the title of my research proposal is determining if the antibody bevacizumab and fluorescent antibodies can detect vascular endothelial growth factors in non-cancerous and cancerous tissues. Statistically, head and neck cancer is the sixth most common cancer in the world. It can affect your oral cavity, sinuses, it can affect your pharynx and your larynx, and many other parts of the head. And these types of tumors in the head and neck are primarily like soft tissue tumors or sarcomas, and they metastasize very quickly through the blood vessels. And so, this is kind of what this research is mainly targeting. So, a little bit of background information on this topic. First off, is the vascular endothelial growth factors, and these factors bind to receptors in the cells that line the blood vessels, and this is what causes the soft tissue to grow. Second is the antibody bevacizumab that is going to be used. This antibody has a history of restraining the fast reproduction of endothelial cells, which stunts the growth of the cancer. So that's primarily why it's going to be used. However, to visualize the vascular endothelial growth factors in the tissue samples, fluorescent antibodies will be used, so it's available to see underneath the fluorescent microscope because that bevacizumab binds to the ligands, and the fluorescent antibodies will attach onto that so you can see it under the microscope. So, also to compare the effectiveness of this experiment, the control tissue will be the xenografts from UAB, and those will be head and neck cancer tissue samples. And for the experimental tissue, those will be gathered from preserved cats and primarily from their jugular vein and their carotid artery. And in order to perform this experiment, there are two main steps. The first step being tissue preparation of the preserved cats, and the second being fluorescent staining of the xenografts and the preserved cat tissue. For the budget, the expendable cost and the travel costs were calculated, and the overall requested budget of this experiment was $904.90. Jacksonville State University is providing the fluorescent microscope, the procedural equipment for the fluorescent staining, and the preserved cats. So, one justification for the budget was the purchase of the monoclonal antibody bevacizumab at a total of $522. And this is necessary for the experiment as a whole because this is what will identify the vascular endothelial growth factors. Also, the timeline for this proposal was to obtain and fund the research and gather the supplies by April of 2017. Also, to perform the experiment before the expiration of the bevacizumab, which is 20 days, by July 2017. The presentation is to be expected October of 2017, and the publication is to be expected in January of 2018. So, overall, choosing to donate to this specific research would make the unknown area of metastasis known, and the overall benefit and goal would be to just prepare a more effective care plan for the patient because that metastasis area would become known, and mainly to expand the lives of many who have been affected by this horrible disease. Thank you.